The Mount Horeb Clinic for Upland Hills Health is always expanding their services, and today we're going to be talking with three fantastic providers who are going to talk to us a little bit more about what those services are, which include family medicine, physical therapy, and OB/GYN. My guests will include Dr. Joseph Berg, who is board certified in family medicine and currently seeing patients in Mount Horeb, Kari Tranel, physical therapist at the Upland Hills Health Therapy and Wellness Center, and Chris Thomas, also a physical therapist at the Upland Hills Health Therapy and Wellness Center. Right here from the Mount Horeb Clinic of Upland Hills Health, I'm Justin Riley, and this is Wisconsin Doctors. Welcome back to Wisconsin Doctors. We are talking about the expansion of services that are offered here at the Mount Horeb Clinic, part of Upland Hills Health, and I'm joined by a fantastic team of providers. We have Dr. Joseph Berg, Kari Tranel, and Chris Thomas, the latter of two of whom are physical therapists here at the Mount Horeb Clinic. Welcome, everybody.
Thank you.
Good to have you with us today. So I just want to start out by, obviously, Dr. Berg, we've had you on the show before, but if we could each take a little bit of time and give a little bit of background of where you've come from, what your education has been, what your experience has been, and what brought you to Mount Horeb. Dr. Berg, let's start with you.
Yeah, I'm Dr. Joe Berg. I started in the Mount Horeb Clinic about a year and a half ago. This is actually my first job out of my training. Previously, I lived in Des Moines, Iowa, where I trained, and then I moved up here, and I lived in town. Actually, I live right around the corner from the clinic, so it's a nice little 3-minute commute. Yeah, it's been a great experience, and I love working here.
And what are some of the services that you provide here?
So I'm a family practice physician, so I will see pretty much everything. There are things, of course, that I don't see as family practice, but I see babies in the hospital, I'll see your newborn, I'll do your well child exam, or I'll go see if you're in a nursing home or in the hospital. So the gamut of medical care I can see.
You can do it all.
Not all, but
you can do
a lot.
most.
Yeah, thank you.
So Kari Tranel, how about you?
Yes, I'm a native of Mount Horeb, grew up here, graduated from high school here, moved away for a period of time, and now I'm back in the area. I'm a general physical therapist. I can treat and see everyone and anyone, but I have a strong passion for pediatrics for kids. So I work with those age from birth all the way up to, well, whenever.
I'm just curious to know, and this is just a sheer curiosity on my part, but when you work with kids on a physical therapy standpoint, what sorts of things do you typically see with kids?
Well, in terms of diagnoses, they can range. They can range from medical diagnoses that are more familiar, like cerebral palsy, spina bifida, Down syndrome. It could also be a lot of those unknown diagnoses, or where children are struggling or not keeping up with their peers.
Sure.
That's where it's most identified. Maybe as an infant, they're not rolling over or sitting up. And so those are areas that I can help address for those children to get them back on those developmental milestones.
Sure, and that may not be anything that's a serious issue. They just aren't keeping up for whatever reason.
Exactly.
Yeah.
It doesn't have to be one of those diagnoses that everyone recognizes.
Yeah,
a little bit of everything.
Yeah. Chris Thomas, how about you?
I've general physical therapist again. I've been with Upland Hills Health for 14 years, I think, starting this year. And I've seen through Upland Hills Health patients in Land's End, Barneveld, the hospital, inpatients, nursing home, and now hopefully in my hometown of Mount Horeb. My wife grew up here, so it was a great spot to come back and be much closer to family. So we've been living here for almost 20 years.
And you guys are all really uniquely a part of this community. I mean, you're not commuting from, 2 towns over or something like that. I mean, you're well within, like 3 minutes away, for example. I mean, you're well within probably 10 minutes or less. Everybody can drive and be here.
5 minutes, yeah.
Yeah, that's fantastic. That's fantastic. I'm curious to know we just have a little bit of time left in this segment, but what do you guys think that the reason, or the benefits, I should say, of having this clinic here in Mount Horeb? Was there a need for it that you noticed at all?
Yeah, I definitely saw a need, especially for physical therapy services. I mean, aches, pains, back pain, knee pain, all types of things require physical therapy help. And when I would want to send somebody to see a physical therapist, I would need to send them a couple towns over or to the hospital for them to be seen in an appropriate time. So this is going to be fantastic, and I'm excited for it.
Well, we're excited to keep talking about it. We got to take a short break. When we come back, we're going to continue talking about the expansion of services here at Upland Hills Health Mount Horeb Clinic. We'll be right back with more Wisconsin Doctors after the break. We are sitting here in the Mount Horeb Clinic of Upland Hills Health here on Wisconsin Doctors, and we've been talking a little bit about the expansion of services that they offer here at the Mount Horeb Clinic. And Dr. Berg, I want to just talk to you real quick here because you are one of 3 physicians that people can see. So can you give us a little bit of a background of who else you're working with here at the Mount Horeb Clinic?
So besides me in the family practice area, you can see 2 of our OBGYNs. We have Dr. Maria Sandgren and Dr. Timothy Reichel. They're both fantastic OBs. They came to us from larger, more busy practices in Madison, and they're very good doctors. Yeah.
Awesome. And you know, we talked a little bit about this during the break, but when do you think is it appropriate for somebody to see their primary care physician? Because you know, there's so many different specialists that you can go to, and you know, God forbid, you might end up in the emergency room. But we really talked about the idea that a primary care physician can sort of act as an advisor. Can you talk about that a little bit?
Sure. The way that I think all medicine should work is each person should have their own primary care physician as their advocate, as their guide through the healthcare system.
As an advocate, yeah.
I kind of think of myself as the leader of the team. You know, I'm the doctor that you should come to first if you have an injury or an illness, and I can kind of triage you. Most of the time, I can take care of it. You know, if you have a simple knee injury, a lot of times I can find out if it's a sprain or a strain or a break. I can do appropriate images or like conservative treatments. And if there's other people that you need to see, if I think you maybe tore a ligament, I can have you go see an orthopedic surgeon. If I think that the injury is bad enough where a physical therapist would be very helpful, I would refer you over to Chris or Kari here. So again, I'm the leader of the team. If you have a question about care, if you wonder if it's more appropriate to go to a different type of doctor than to me, or if you have a question about a test that you got at like a wellness screening or something like that, I would be the person that you could come to for that, and I could help you guide you through that and refer you if I need to another location.
And as I understand, you can also do general surgery pre and post visits, is that right?
I can't, because I'm a primary care physician, but we do have general surgeons. They are mostly out of Dodgeville, but we're working to get them to see patients in our clinic here, so to again expanding our services,
right,
making it easier for people to get in and get the care that they need without a 25-minute drive.
Right, and that's kind of the nice thing is that, I mean, this really is a kind of a prime location for this kind of healthcare being available to folks. So
yeah, I mean, Mount Horeb is a great community, and I think we're growing. And I think we have a lot of people that are young professionals, a lot of people that often have to drive into Madison for their care or drive down to Dodgeville. So I think this is a good place for people to come and to get their care.
Absolutely. And Kari and Chris, I'm going to turn to you for just a second here because, Kari, you talked a little bit about what you tend to see kids for as far as physical therapy goes, but I'm wondering if one of you can speak to a little bit about what you're typically seeing here as far as adults coming to you with their needs for physical therapy.
From a physical therapy standpoint, we are so used to seeing the age range, anywhere from the pediatric range all the way up to the retired folks that are here in Mount Horeb or near here with geriatric needs or total hips or total knees or arthritic conditions and everything in between.
Okay.
So that is really what is our strength, is anything that comes through the door, we are going to be pretty effective at getting down to treating that effectively.
And getting it moving again. I think that's the big thing. So
Yep.
we're going to talk a little bit more after the break about the Therapy and Wellness Center in which we are sitting right now, right after the break here on Wisconsin Doctors, so don't go away. And welcome back to Wisconsin Doctors. We are in the Mount Horeb Clinic, specifically Suite 104 in the North Cape Suites. Sort of the main drag here at Mount Horeb. I mean, it's pretty easy to spot from the main road as you're going through. And this room in particular, I think right now is going to be designated as the Therapy and Wellness Clinic. Am I right about that?
Yep.
So we're hoping that, obviously, expansion of services is what we're talking about today. So let's talk a little bit about physical therapy. And I know, Chris, you mentioned in the last segment that the variety of patients that you see is not really limited to one group of people. It's not just, you know, elderly or athletes. There's a wide group of people that you see. It's everyone and anyone and everyone.
Correct.
Kari, I'm wondering if you can just expand on that a little bit and just talk about specifically some of the different things that maybe, you know, if it's not an athlete or not an elderly person, you know, what are you seeing?
Oh, definitely. In physical therapy, the beauty of it is we can see anyone and everyone with
Right.
whatever injury. So it might be something as simple as you had a slip or trip on the ice, which we have plenty of that this time of year, and you have a bruise or a pain from walking with that. We could also see individuals that may have chronic pain issues in their shoulder or neck or back, and we can work on that hopefully with them. Also see any of those that are post-surgical, maybe had a total hip or a total knee replacement, and that would be the other end of our age range.
Sure. So it really can be any. I mean, do you see a lot of high school athletes here? Is that something that that's pretty typical?
Yep, we're set up at the hospital with several contracts with the area schools. So as those athletes get injured, those students get injured, they often find their way to our area through their primary physician, setting up those cares, and then we get them set on a plan to get them where they need to be, and that is very individualized care that we try and address. So as they come in the doors, depending on what they want, what they're looking for, we'll set up their plan to make sure that we can get them there as fast as we possibly can. And that's not just athletes. We'll try and do that with pretty much everybody that comes through the doors, whether it's a recent injury that they just had slipping on the ice, or if it's something that they've been dealing with for a number of years that they didn't think they could do anything about, and they just finally decided to do something about it. But we're absolutely comfortable treating that whole spectrum.
And you talked about developing a plan for these folks. What do you hope to accomplish by treating folks with a physical therapy plan? Does it just depend on the patient? What are your hopes?
As people present, sometimes it can be easy as, I want to be able to climb the stairs without pain. And that would be different from an athlete coming in saying, I need to return to sprinting as fast as I can in 3 months.
Out on the track or on
so
the field.
those goals are very different based on who comes in. And talking with the patient and getting those questions drawn out of them and get those answers so that we can set up that plan according to what they need and what their desires are to accomplish from physical therapy. So it's not something that we're scripted and we know exactly what's going to happen every time an ankle comes in.
Right.
A sprained ankle comes in and we need to look at that ankle and see what's wrong with it and then develop the plan according to what that particular person wants to accomplish.
Wide variety of different folks, wide variety of injuries, and wide variety of different plans for people, just depending on what their needs are. And their ability probably before they come in as well, I'm guessing.
Correct.
So one of the things that you guys are going to be expanding as far as services go is eventually acupuncture and massage, as I understand. Can we talk a little bit about that?
Our hope is to offer acupuncture as well as massage therapy and also occupational therapy services for hand injuries or shoulder injuries or elbow injuries here based on the need of the Mount Horeb residents.
And I think that it's so interesting because there are more and more studies that are suggesting that there really truly is physical benefits to acupuncture and massage. Can you talk about what some of those benefits are?
Oh, they can, wide ranging, but definitely
Yeah.
for massage, even from a mom and of 3,
Right.
it's great for relaxation,
Sure.
to taking that me time and taking that time out to just focus on yourself, but also that carries over the benefit of if you've been injured or you're hurting or you're stressed, it helps to release some of that tension and get all those good hormones going again.
It's so interesting how just that release of tension can release positive hormones, that make you feel better. So
Yes.
very
Yeah.
cool, very cool. Well, we're going to come back in just a minute after the break right here at the Mount Horeb Clinic of Upland Hills here in Wisconsin Doctors, so stay with us. And welcome back to Wisconsin Doctors. We've been here on location at the Mount Horeb Clinic of Upland Hills, and we've been talking about the expansion of services that are offered here and are continually expanding here at the Mount Horeb Clinic. And I think it's interesting to know, we've had some great conversation while the cameras are off here, of course, but we've had some great conversation about how, Upland Hills has really evolved over the last 20 years, and it may not be, if someone has lived here or in this area in southwestern Wisconsin most of their lives, it may not be the same Upland Hills Health that people remember from 20 years ago. And also, if you're new to this area, this might be a good option. It's right here in home. I mean, if you're on the west side of Madison, or if you're anywhere here on the western end of Dane County or eastern end of Iowa County, it might be a great place to go. But here, I'm talking too much about this, and I know little to nothing. I'm wondering if you guys can share a little bit of knowledge and give some folks reasons for why, if they've never been to Upland Hills Health, particularly this clinic or the hospital, why they should consider it.
Yeah.
Who would like to start?
First of all, I think Upland Hills, and especially our clinic, is a convenience.
Sure.
Especially for our area. I have lots of openings still. I'm still building my practice, so I can often get you in the same day.
Yeah.
Or very shortly after that. It's a convenience because it's easier to kind of access what you need. Upland Hills is just a 25-minute drive straight down 151. It's one exit. There's one front entrance. Okay, you see one person, they direct you where you need to go, and you're in and out. It's not a long wait. It's not a problem with parking. You don't have to worry about a lot of traffic. It's very convenient for our residents, I think.
Yeah, absolutely. And I think even people who live outside of Mount Horeb, my goodness, same day, you call this clinic, and the chances right now of you getting an appointment today would be very, very possible. Very, very possible.
With the way the traffic's been set up, with the addition of the highway, it is faster for me to get to Dodgeville than it is for me to hit Madison. And I can be essentially in Dodgeville in 20 minutes. And I've got 2 teenage boys. I've had to visit the ER several times, and I can say that I've been able to 20 minutes. It comes with the territory. It really, you really want to find a fast action. So I can get in my car, get my stitches done at the ED, and I can be back home before my kids would even be evaluated on some of these busy nights in Madison. So there's just that convenience of being able to be seen by a great resource and great professionals, and get back, and it really disrupts your life very little. It's very convenient.
And talk about some of the services that are offered at the hospital. I mean, really, the services that are offered at the hospital are very comparable to services that you would find in a hospital in a bigger area. So you guys were talking about that, and you spoke it so eloquently. I'm wondering, can we replicate that today?
Yeah, so people don't really know that Upland Hills has an MRI machine. That's not very common for critical access hospitals. We have a digital mammogram. We have high-resolution CT. The same emergency room physicians that work at St. Mary's downtown also rotate through in Dodgeville at Upland Hills Health. So some of those things you may think of, like, oh, I need to go to St. Mary's, or I need to go to UW to get, you can get in our critical access, our rural hospital.
And we have specialists from St. Mary's that come out to the hospital, and we have specialists from UW that come out to the hospital, and we have our own specialists that are Upland Hills Health only physicians. So it's done a really, really good job of developing itself over these last several years to really encompass a lot of healthcare needs for anybody that comes in through the doors.
Yeah, residents really have access to that really high quality health care. What about insurance? Anybody can talk about that at all as far as what insurance provider you have to have in order to be able to have your care covered at Upland Hills Health?
Upland Hills Health, because it's in Iowa County, it has basically the primary contracts for all insurance companies.
Okay.
It can see pretty much everything because of its position. Being on this side in Dane County, there's a little bit of a change, but we always encourage people to call and find out if you've got an insurance. For the most part, we will be able to accomplish anything that you need through a vast majority of the insurances that you have.
And I would also encourage people that if your insurance isn't covered by us, it would make a difference if you would contact your insurance company and say, hey, I want this added convenience. I want to be seen in the Mount Horeb Clinic.
Yeah. So that you could potentially work with your insurance company and
Exactly.
they might help you out with that.
Yeah.
Yeah. It's been great talking with you folks today. I can't believe we're out of time already. We could talk for probably another couple minutes at the very least about some of the great things that can be found here at the Mount Horeb Clinic of Upland Hills. I want to thank all my guests, Dr. Joseph Berg, Kari Tranel, and Chris Thomas, both physical therapists here. Thank you so much for all your information and for joining us today.
Thank you.
That's all the time we have for Wisconsin Doctors. From all of us at Wisconsin's 57, we invite you to live longer, live better. We'll see you next time.